My mom had been having some bouts with cough, colds.
I thought I had the flu, but it wasn't the flu. When they took me to the hospital, they realized it was cancer.
They came back a couple hours later and said, you have a very large mass on your lung. Did you know you have lung cancer? And that was when the whole journey began. Her sister was diagnosed, same exact non-small cell lung cancer with metastasis to the brain, about 3 months after her initial diagnosis. And her sister passed within 6 months. But it goes beyond a little bit more of just having that supportive family, because it does impact everyone. There's multiple doctors' appointments. You're not just talking about the oncology component of it. You have endocrinologists, we have pulmonologists, you have physical therapy, occupational therapy. There's so many other components that go into it.
There's so many patients that are struggling right now. The families are working to lose the hours from work for the spouse to bring them, makes it a big stress on the family and the loss of income, and they can't afford it. Having the American Cancer Society available to provide rides so that the other spouse can be at work and they know that they're safe and the patients and their family members getting treated helps tremendously on their stress levels.
So we've been under chemotherapy for about 2 years, and we just started a new treatment, immunotherapy. Right now, immunotherapy, it takes about 4.5 hours of my day. When I take her, by the time I leave my house, pack up my little one, drive to her home residence, bring her, drive 45 minutes there, go through the therapy, go back. I mean, it's a lot of your day. I had to seek alternative resources to assist in the process. And that's when Dr. Naim's office and Walsh had referred me over to Road to Recovery. And it was pretty simple.
And Annie had mentioned that the American Cancer Society, she said, that they drive you, they'll pick you up.
I can tell you daily, I talk to patients that are having problems financially, as well as the ability to get access to care because of the inability to get here. This transportation is so important. There are so many patients in this day and age where financially it's difficult for them to get to the office. Having the ability for us to call the American Cancer Society and say, listen, we have someone that needs care and can get here so that they can get the proper care and treatment for their cancer, I think is very important.
You only are limited to a certain number of vacation, sick, personal days. So knowing that I have a resource that I can pick up the phone and feel confident that I have it covered, and that stress level is huge. I mean, it lifts a huge burden off you. I don't think we've missed an appointment. So, and that's thanks to the resources that are available out there, specifically, Road to Recovery. I can't imagine how stressful it would be worried about how are you getting your loved one to and from treatment if you're in a different state, or if you're not nearby, or just if you physically can't do it. You have this resource there, and burden reduces tremendously. Funding it is essential. And I would definitely say it's worth it.
And if I can help raise money or whatever, do a dance, I'll do it. I don't dance good, but I can't stand too long.